We have passed 5 bills to lower the prices by helping to reduce the prices of generic drugs into market so that they are marketing faster and more broadly, and 5 key bills to strengthen the protections for pre-existing conditions, reverse the sabotage we've seen of the Affordable Health Care Act here, and expand the number of Americans with affordable coverage. The polls, it's interesting to note that the polls continue to show health care as the #1 issue in the Congress. I am certain that the reason we were able to flip the House so that Democrats are now in control of the House began with health care. To be sure, there were other issues that were important as well, but none more important than health care. And with seeing what saving the ACA can mean for Americans throughout the country. And so in deciding how to speak about this issue in my own district, and people are doing various things. Sometimes they're looking at specific conditions or some of the issues I just named. But I thought that the best way for the District of Columbia to discuss this was to look at how the District of Columbia has, for all intents and purposes, saved the Affordable Health Care Act, and even saved it in ways that mean that it does not raise the prices in the same way as we have seen almost universally, where people weren't able to intervene in the way we have in this town. And so it is fair to say that DC Health Link, you will hear from our director very shortly, has taken the district to the #1 state health provider in the country. And I think we have to hear first from Mala Kaufman as to how that could possibly have happened when we see all around us examples of what happens when it doesn't happen and what it means to our residents and to the District of Columbia, that somehow or the other we are, she will show us, when I say somehow or the other, Mala will show us what I mean by that somehow. We've been able to do that, and probably most of you have not felt the kind of dislocation that we have seen in other states. So how we purport to do this is just very informally. I can't say enough in gratitude about how thankful I am for those of you from the district who have been willing to say in your own terms what it has meant to you. Instead of hearing from me or even from Milo, this is what it's supposed to do for you, to speak to real Washingtonians so that others can see what is, by the way, probably already understood. The district, because of the way Mala and our mayor and our city council have treated the Affordable Care Act, in the district, I think it's fair to say, there is no one who should be uncovered. And if they must live under a rock, and I want to find them, because there is really no reason not to be covered in the District of Columbia. I cannot say that around the country. There will be plenty of reasons for others. So I thought the best way to get started would be to ask the director of our own DC Health Link, Mala Kaufman, to give us the outlines of what the district has done to make the Affordable Health Care Act, DC HealthLink, not much different now than what it was at its highest point. Marla, thank you so much for being with us, and I'll turn it over to you at this point.
Thank you, Congresswoman. And I just want to start by thanking you for fighting for DC, for fighting for the Affordable Care Act. Most people around the table probably don't know, but I'll give two examples of your fighting and your leadership to save the ACA. Early on, there was an attempt by some elected officials who don't support the ACA to prohibit us from implementing our funding mechanism, the way we assess health carriers so we can operate. Well, you battled not only on the House, but also on the Senate to make sure that never became law.
Now, you're talking about keeping the DC in particular.
Yes.
I think you could, I mean, she doesn't just mean keeping everyone else, but seeing what the district was doing. You describe that a little bit more. How could they get at the district and not get at other people who were trying to do the same thing?
Yes, they specifically wanted to introduce legislation that targeted the way DC funds our DC HealthLink, and we do it differently than other states, so it was very much targeted at the district, and you stopped that. Also, after DC policymakers passed our own DC individual responsibility requirement, and we needed to do that because otherwise premiums would have been increasing even more. So the mayor and the council passed it unanimously. Well, there was an effort on the Hill to put a rider on appropriations legislation to prohibit the district once again from implementing our policy. You fought both in the House and in the Senate, and you helped stop that. So I just want to start by saying thank you for the battles you fight specifically to protect the Affordable Care Act and DC HealthLink in the district. So I'll just say a few things about the Affordable Care Act. It made health insurance real. So health insurance now works not just for healthy people, but for people with medical needs. And before the ACA, of course, you needed to be in almost perfect health to even buy private health insurance. Now people with pre-existing conditions have full protections, cannot be rejected, cannot be charged higher rates. Very important. Now, the ACA put a stop to all of those bad industry practices, and DC leveraged that to do even more. We established a locally managed and controlled online health insurance marketplace, and because we did that, we've been able to do a lot more than many other states. So as a state-based marketplace, and by having one, we were able to achieve near universal coverage. So now more than 96% of DC residents have health coverage. And since we opened for business October 2013, we've cut the uninsured rate in half in the district. Being local also means that we were created from the ground up. You mentioned earlier, what's the recipe for our success? What's the secret? It's really being built from the ground up through many diverse stakeholders at the table. We had brokers, we had consumer and patient advocates, we had the business community, we had physicians, hospitals. We had everyone at the table helping figure out what our priorities, what values we had, what we wanted DC HealthLink to look like. And one of those things we did was we require standard plans, which means that no matter what your deductible is, even if you have bronze coverage and you have a very high deductible, you get access to certain medical care without having to meet your deductible. If you need urgent care, or if you need to see a specialist as many times as necessary, your primary care physician, your mental health provider, all before meeting your deductible. And so that's one of the benefits of being local. Also, being local means we have empowered our consumers to make more informed decisions. There's full transparency. Small businesses and individuals can shop apples to apples and see all prices. Consumers are finally in the driver's seat, not insurance companies. And in fact, we have consumer decision support tools that help people make better decisions, and we're ranked #1 for our consumer decision support tools now for 2 years in a row. So for instance, if you take lots of medications and you need to figure out how they're covered on the formulary, put into our system up to 10 medications, the dosage and the name, and instantly we will tell you how each health plan covers it and whether it's covered. That's why we're #1. We cover 100,000 people, and that includes more than 5,000 district small businesses. And for the first time, residents and small businesses have the purchasing power that only large employers have in the past. Our small businesses can offer all insurance companies a choice of all of them to their workers, get one bill, super easy, and their workers are happy because Kaiser may not be right for you, but it may be right for someone else, and you have broad choices. Being local also means more control. And so, as you mentioned, when the federal government tries to sabotage the Affordable Care Act and the security that people get with health insurance, we've been able to intervene and protect our consumers against those attacks. We passed very good standards to prohibit junk plans. And so in the district, you have to comply with consumer protections, very strong ones. You cannot sell junk plans. We passed the individual responsibility requirement to keep premiums from going even higher. We expanded open enrollment. We've invested in navigators and assisters and marketing to make sure that people are learning about us and to also make sure that we're attracting enough younger people, because for rates to be stable, you need enough younger and healthier people. So we can do all of that because we're local. And we advocate for the lowest possible rates for our customers. In fact, we hire outside actuaries every year. They provide us with full analysis, and by advocating for the lowest possible rates based on actuarial analysis and policies, we've saved our residents and small businesses millions of dollars each year in premiums. Now, despite all of that, I'll say premiums are still too high and we have to do more. But we can't do more just by ourselves. No state can do that. We need you, we need Congress to step in and become a better partner, just like it was when the ACA was passed. We need Congress to reinstate reinsurance and do more on APTC, federal premium reductions, to help people make sure that they can continue to afford premiums. And I'll just conclude by saying we stand ready to continue to fight for our customers, to advocate, and we stand ready to fight with you and do whatever it takes to help you make health insurance even more secure and more affordable. So thank you.
Ms. Mullen, well, we all owe you a lot of thanks, and I think you could tell that. Because I think some of what you have told us perhaps was not altogether known even by our own folks. This is what I like to do now. I like to go around the table. Now, my list could not foreshadow, I think, where people would sit. So I'm going to start here. When you give me your name, I'm going to look up it, and then I will introduce you. So would you tell me who you are?
My name is Tamrat.
Your name is what?
Tamrat.
Your name is?
T-A-M?
Tamrat, yeah.
Yeah, that's right.
Who is a District Health Link sister with Mary's Center. He conducts outreach and enrollment to district residents for coverage through DC Health Link. And Tamrat is going to speak with us about the people he's helped to enroll in coverage and the importance of providing health insurance to the residents who received health care through Mary's Center. You start by telling us who Mary's Center is, because this is very important in light of what you're going to talk about.
Okay. My name is Tamrat. I'm in-person assistant at
Can you all hear,
Center.
Tamrat?
Mary Center is a health providing service center. At Mary Center there is social service program and a health service program. There are physicians there. So residents who know about Mary Center come for health program service and social service. Among the social service, the in-person, the health insurance enrollment program is one segment where there are staffs who provide health insurance for DC residents. So whenever patients come for enrollment, we provide them the importance of health insurance, and we provide them one-to-one counseling, and based on the documentation that they bring, we let them enroll for health insurance. That are, broadly speaking, the service that we
So Mary's Center covers virtually every social issue.
Yes.
Are most of your constituents Spanish speaking, or many of them?
Basically, as far as language is concerned, most of the patients are coming Spanish speaking, Amharic language speaking, and other French speaking.
Well, you can see how vital the service you provide is. Those of us who speak English had a hard time following this ourselves, so it's a very vital service. We're going to next, I'm sorry, could I have your name again?
Sure, I'm Katie Nickel.
Yeah, and I found it once. Katie Nickel
Yes.
has been a DC HealthLink advisor with Whitman Walker since the inception of the program in 2013. She oversees the work of more than 30 assisters since the implementation of DC HealthLink, a sister program. Katie Nichols is going to speak about her experiences and challenges, as well as her successes in enrolling residents in coverage through DC HealthLink, the specific clientele and how you get them enrolled.
Sure. I'll talk a little bit about Whitman Walker first. So we're a federally qualified health center here in the district.
You tell people what a federally qualified.
Sure, it's a health center, and we specialize in HIV and LGBTQ care, and really having on the focus of providing an inclusive, integrated care model. And part of that is our DC HealthLink Assister program, where we receive funding from the Health Benefit Exchange.
How do you get to be federally qualified?
So to reach that level, we've had to meet particular requirements as a health center, and having a pharmacy and also other inclusive services, being mental health, medical, dental services, and other auxiliary services to support our medical care and our patients. And inclusive in that, and what makes Whitman Walker unique and our program unique, is that we have our legal services program, which is the oldest medical legal partnership in the nation. And we have our insurance navigation team, which is our team of DC HealthLink assisters. And we started that program in 2008 and have really led the effort of what it is to do enrollment and screening, and then with the implementation of the Affordable Care Act, and the benefit exchange and the DC HealthLink Assister program, that was a natural move for us. And through that work,
You say, what is an assister?
So an assister is an individual that is a trained expert on the Affordable Care Act and plan options and understanding how it is to provide that service and helping someone navigate the process of enrolling into an insurance program.
I think this is very important. To say to people, just go online and you'll figure it out, is really to put too great a burden. When you, particularly a new system, but certainly a healthcare system with what you've just heard described, and with all the help that we can get for DC Health Link, you need somebody to help you get through this system.
Right.
Just like an insurance agent, if with my health insurance, I don't try to figure it out, there's an agent who's supposed to. Why shouldn't everybody on DC Health Link have the same?
Right. And what we've experienced is the same people come back every year, even though we've talked them through the process, have done literacy and understanding of what it is to have health insurance, what the plan options are, and all of those things, have gone out into the community to really find them. They still come back to our different programs to
Need assistance.
to get that help to understand what it is. What are the plan options this year? And for us specifically, at Whitman Walker, what we've really seen, because of our patient population being those living with HIV and facing stigma due to other chronic illnesses, seeing the removal of the being denied due to pre-existing conditions has been life-changing. And having affordable plan options through the benefit exchange has also been life-changing and having those plans open to anyone that is eligible has really made a huge impact, especially for DC residents.
So all of your clients would have a pre-existing condition, so none of them would be.
Pretty good portion of it. So our work before the ACA, a lot of it was trying to help people navigate what their options were, where they wouldn't be denied, or what was affordable, to now having this myriad of different options, whether it be Medicaid or a plan or whatever their transition may be, has really improved our health outcomes.
On pre-existing conditions, I've never seen any statistics, but I would imagine that most people can't get to be above 5 years of age without having some condition that would qualify as a pre-existing condition. The notion of having super perfect health your entire life and then going for health insurance is a bit much to ask of anybody. Thank you very much. Now, you are?
Sullivan Robinson.
Robinson, yes. Sullivan Robinson manages the DC Health Link Assistance Program with the Leadership Council for Healthy Communities. She also assists customers, educates them about the essentials of the ACA, and encourages them to roll in coverage through DC Health Link, with a primary outreach focus to the local faith-based institutions. Robinson is going to speak about what her organization has done in the DC faith community, and share some of the success stories of those who have enrolled in the ACA.
Thank you so much. It is my privilege, really, to speak for the Leadership Council for Healthy Communities and talk about our involvement in the Affordable Care Act through DC Health Link. We were a part of making sure that the district got the Affordable Care Act and the exchange from the very beginning, because we knew how important it was for our community. The Leadership Council for Healthy Communities is a network of faith institutions, the leadership of those institutions working with some medical professionals to make sure we have health-based programs that are centered in those faith institutions, so that we were about promoting health, bringing education and inspiration to our neighborhood persons and our constituents. And when the Affordable Care Act came about, what we recognized is that more than anything, we needed to be sure that all of our neighbors were insured. And I'm using neighbors as a friendly, connected piece that we try to reach out through the communities to work with each other. Personally, I appreciate the concept of not having to worry about pre-existing conditions, because I've had a pre-existing condition, and I've been in the market when I had to pay $1,400 a month to get insured. So it was really a important piece that we wanted to bring to community. And through our church environment, or faith institutions, because we have more than churches, we found that not just the people sitting in the pews, but as you spread it out to their families. The grandmothers always had a grandchild that needed to be insured, an adult who needed to be insured. So we were able to reach a lot of them. And what we do at the Leadership Council, we have assisters placed in various centers throughout the district so that we can meet people where they are and make sure that they are insured. We have people working at Covenant Baptist Church, for example, in the district, at outlets for DOES, that is the Department of Employment Services, when people come in. Okay, so that we have outstationed people who will outreach and enroll people as they come in. And we have found that it has just been an enormous help to the people who need to understand insurance better, the education of how to use these cards and what it means and what value you have when you can get annual checkups through your insurance and save in the long term, catch conditions that you didn't realize you had oftentimes. And people come back to you and let you know how much they appreciate being able to be insured. So that we've been with this process and assistance from, like I said, the beginning in 2013, and we continue to be pleased that we can make the kind of contribution, the kind of impact in the DC community. Although we're 96% insured, there's always turnover, there's always new people coming in town, and we want to make sure they're insured as well. And I hope I have responded to your inquiry.
I think you have. This is a very dynamic situation, particularly in the district. In the district, we are in the top 10 cities in growth and population. So this figure, which is an important figure, means that if you've been here, you almost surely are covered. So the dynamism of the economy means somebody, for example, who moves from a place that didn't have the kind of outstanding service that DC HealthLink had may simply assume that that's it. So this figure, and whenever you see a population figure which is 97 or 98%, that means everybody. It's the movement between those who come and go that is reflected. And the next, say your name please.
Paulette Sheffield.
Paulette Sheffield
Yes.
is a DC Link sister, and it's been one since its inception. The Sheffield works with the Leadership Council also on health communities and has enrolled hundreds of residents in health insurance. And she's going to speak about the advantages of enrolling in quality, affordable health insurance through DC Health Link. Thank you for being here.
Thank you. It's been a gratifying experience to be able to insure persons in the District of Columbia and inform them about the options that they have for affordable health care coverage. Informing persons about their options, letting them know, especially about the pre-existing condition and being able to be covered. One of the very first persons that I enrolled had a pre-existing condition, had a brain tumor, and had been unsuccessful in getting health insurance. And I was able to get her enrolled. She was ever so thankful. She, as a matter of fact, keeps in touch with me periodically now to let me know that she's doing extremely well. Having this health insurance, affordable health insurance, being able to actually continue the care that she's needed with the condition that she had. She very much appreciated that. What we have found out in terms of enrolling persons is informing them about not only informing them about their health care options, but also letting them know how to use their insurance. Interestingly enough, persons who we have enrolled, it's not just about getting the health care coverage, but it's about what that coverage is, what's covered by the insurance that they have, and how to use that health care, how to use the coverage. I'd like to talk about one example that I had one gentleman who I enrolled in health insurance, and he was ill. It was in the dead of winter. It was ice and snow on the ground, and he came running up to the office because he was sick. And he wanted to know, okay, I have my card, but what do I do now? And so I'm like, well, you're ill. You have that card. That means you can go to the doctor, you can go to the hospital, you can go to a clinic and make sure that you get the care that you need. But just having that card wasn't enough. He didn't know what to do when he had the card. So it has been my privilege and a wonderful opportunity under the Leadership Council for Healthy Communities to be able to not only enroll persons, but to inform them about their options, about the coverage that they have, what that coverage is, and how to use that coverage. So it's been a gratifying experience, and I have been there since its inception, so there have been a lot of opportunities to share this information and be able to help the persons in our community.
Well, doesn't that speak volumes that when you don't have universal health care and somebody gives you a card, that in a country that does not have experience with this, you wonder, well, what's next? And that's what I think your stories will help the public to understand as this is being filmed and shown around the city. And next is
My name is Colin Connor.
Colin Connor, who is an employee with Good Shuffle. Good Shuffle is a district small business. He's enrolled through the DC HealthLink Shop Marketplace. Mr. Connor is a part owner. He can speak about what the coverage has meant for his own family, and has a unique perspective from growing up in Canada, where the government has long funded health care.
Yes.
We are an outlier in the world in that respect. Yes, sir.
Well, thank you so much. It's a pleasure to be here. And when I first came to the United States, my wife and I enrolled through DC HealthLink to get the health coverage that we could afford or that was suitable for us. And as soon as I started with Good Shuffle Pro back in September, I was so thankful to have the more expanded range of coverage to be available to us. And the company was kind enough to put both myself and my wife on a program through DC HealthLink. And it's just been incredible because we both come from performing arts backgrounds where there is no insurance or no publicly offered or company provided health care. And so it's just been a fantastic experience to go to the doctor and to go to the dentist, and it's something that has been great both for myself and for my wife, and I'm very thankful for everything that DC HealthLink and Good Shuffle Pro has provided for us.
Thank you very much. Well, did you ever have the opportunity in Canada to be part of a government-funded health care?
Honestly, no. It's coming from a performance arts background that there is the Canadian healthcare system, but when I came here, my wife was great, and DC HealthLink as well was great in being like, what's a premium? What's, what do I do? And so the onboarding and the training that I received from both my wife and from the employees of DC HealthLink was fantastic at getting me afloat and for giving me the vernacular and the confidence I need to select a plan for us.
So, but you would have had health care in Canada?
Yes, correct.
Just want to make sure we understood that. Next, I believe, is Vicki Davis.
It is.
Vicki Davis is a DC HealthLink small business customer. So, Ms. Davis.
So, nice to see you again, Congresswoman. I'm here on behalf of Life Asset. I work for Life Asset as a business developer, finding small businesses to give microloans to. And I'm also an employee of Life Asset. And before then, we would get a stipend to get small business health insurance through Life Asset. But once DC HealthLink came in, we were able to, my premium went from $1,100 a month to $400 a month.
Makes a difference.
Just based on him applying for us to have health insurance. So we have Kaiser as employee base, but a lot of the small businesses that I help, like I said, is a nonprofit that we give microloans to. We're the number one nonprofit in the United States to give microloans to small businesses. And so we have over 1,000 small businesses that we help with business technical assistance and helping them to get their licensing. And mainly those small business loans go towards getting their licenses or inventory for their business. And a lot of them don't know, as a small business, they can get health insurance through DC HealthLink. So we have DC HealthLink come in and talk to them at least once a quarter about getting small business insurance for them and their family. So it really has helped tremendously, not just for me, but for the small businesses that I represent.
So would most of those be startups?
Most of them are startups. So they either self-employed, one person, or they might hire another person, and they don't know that once they hire somebody else, they can actually offer them health insurance.
But a classic group that would be without health insurance, just like those in the performing arts.
Correct.
Classic that would not have health insurance in this country. And next at the head of the table,
Elaine Coronado.
Elaine Coronado
Yes, ma'am.
is self-employed and insured through DC HealthLink through its individual marketplace. She moved from Texas, and she's going to speak about pre-existing conditions, prescription drug needs, and access to medical services. Welcome, Ms. Coronado.
Thank you so much. I was very lucky in that my father was in the U.S. military. And so for the first 26 years of my life, I was covered 100% by the U.S. government. And that's important because when I was 12 years old, it was discovered that I had a spinal issue that required my spine to be fused, which if my father was not in the military, that would have been a very expensive operation. Why that's important to me today is that since then, 40 years later, they've discovered that there's all kinds of new problems now with my spinal condition because they've discovered that what they did 40-something years ago has been made worse. And that's important to me because 24 years ago, I started my own small business here in Washington, D.C. So as I started out, I got my premiums, etc. And I think this is before I really understood the auto pays. And that's important because at one point, I forgot to make a payment. And as I forgot to make a payment, I was dropped out of from my insurance company. And when I tried to get back in, I couldn't get back in because of pre-existing conditions. And so I probably went a couple of years without insurance, just fingers crossed, nothing would happen, trying to take care of myself. And I was lucky that whatever happened, I could pay out of pocket. I could just pay cash for whatever I needed to pay. But I, of course, understand that not everyone has that luxury. Ultimately, when I started hearing about the Affordable Care Act, of course, I'm like, what is that? What does that mean? And when I finally heard that it would also include people that had pre-existing conditions, I went straight to I went straight to my computer, popped in all my information, and I think they probably asked 6 questions. It was minimal. And I hit submit, what have you, and they're like, you're in. And it was so easy, I promise you, that I picked up the phone to call the 1-800 number, and I said, is that it? Because I was so used to before that, all these questions. And for the first time, someone just asked me a few questions, and you're in. And I was very suspicious. But the lady on the phone assured me I was in. Since then, I'm in the system with my pre-existing condition, and I'm grateful that I'm in that system because without it, I would not have insurance. And the medical treatment that I would need it's 6 figures and then some, so it would be very expensive if I didn't have the insurance. So I'm grateful to everything that DC HealthLink does for us. Thank you.
Oh, goodness, thank you. Next is
Jennifer Wistrand.
Jennifer, yes, Wistrand, who is an individual market customer who has been covered in the past through DC HealthLink. She will speak of DC HealthLink coverage for her health when she joined, and the freedom is given her to know to even with pre-existing conditions that she can come back when she chooses and change jobs.
Great. Well, thank you very much. So my story, I moved to DC 2012, shortly after I finished my PhD, and I had a fellowship at the Wilson Center, and that came with health insurance, which was great. And then a year later, 2013, as I was transitioning off of that, I was going to be an adjunct professor at Georgetown for the summer that didn't have coverage. And then I was going to be starting a new fellowship the end of the fall at the State Department, and that came with coverage, but it was they would give me a stipend in order to buy health insurance. So all of this, they would give me a stipend so that I could buy my own health insurance. So this was all fine. I did my teaching, I was filling out the paperwork for the fellowship, and then I had a stress fracture, which I thought was from too much running for training for something, and in the process of different tests, it came up that I had thyroid cancer. And so I had surgery, I was fine, I was treated, I was completely fine, but this was right at the end of 2013, and I was getting ready to fill out the paperwork, and had the Affordable Care Act not been immediately at that point going into effect, it's very probable that I would have had difficulty because of a pre-existing condition, even though I was completely healthy, had had surgery, had no problems. When you go through those questions, you're asked a series of questions, and one will be, have you ever had a cancer diagnosis, even if you're fine, and that automatically kind of shunts you off into a different category. So I'm extremely grateful that the Affordable Care Act was coming into effect when it was, and so one, the pre-existing condition, it very much helped me out, but then two, just what I've proceeded to do career-wise. So I'm an academic by training, and I've always been interested not just in teaching, but in policy work, development work. So I've been able to select over the past 5 years. So I had the opportunity to do policy work at State Department. I've worked as a consultant briefly for the World Bank. I've been teaching at Georgetown, but I've been able to move fluidly between these opportunities because of the fact that I've been able to turn to DC Health Inc. when I need to, if it's an opportunity that comes up that doesn't have health insurance. It completely opened up my opportunities in ways that I wouldn't. And then just to echo what other people are saying, I can't say enough about the kindness of the people when I have called with questions. I am not technologically literate. I get very nervous. I would never be able to hit 6 questions and then just submit. I would panic. So I routinely will call and ask questions. And I have to say people they've been polite, they've been professional, and they've been compassionate too, actually concerned about whether or not you're getting the coverage you need. So I am extremely thankful for the program.
I'm going to say you're a typical American worker today, where you have moved from position to position. I mean, gone are the days when people had what was often a job with a pension and health care for life. And there wasn't much reason to move around. And now, moving around has become a necessity. We also have heard stories of people, and these are really tragic tales, of people who won't move because they're afraid of losing their health care. And they don't live in the District of Columbia where they could still get health care. So your story of being young and mobile highlights another reason why DC HealthLink has been so important to our residents. Yes, you are.
I'm Lisa Caniff.
Self-employed and insured through DC HealthLink in its individual marketplace. Ms. Kenneth moved to DC from Northern Virginia and brought a home here based on the ability to get health coverage she wanted through DC HealthLink. Ms. Caniff will speak to the issue of pre-existing conditions, prescription cost concerns, and access to mental health care. Go ahead, Ms. Caniff.
Thank you. This is my first time ever meeting with an elected official, and it couldn't be for a more important reason. So it's true. I'm from Maryland. I was living in Virginia, and I had a job that was fine, but didn't excite me, and it wasn't my passion. So I couldn't move because I had pre-existing conditions, just exactly what you said. I was stuck. until 2013, when I left my job, I started my business, and that was only because of the ACA. But in 2017, which was my 4th year of freelancing, I was successful, I was hopeful, but my insurance through the national exchange in Virginia had gone up almost 300%. Just in the 4 years, and that's not, and I've got those numbers with me, how it went up every year. That's not co-pays, that's not the high deductible, and that wasn't my prescriptions, which are, I'm required to be on a brand name prescription. I can't use a generic. So I was at a crossroads, and I had to decide whether I should give up my dream of having my company or go back and get a full-time job or move. And when I looked across the river, I saw that my premiums would go down. And
In DC.
in DC, my deductible would be lower. In DC, my coverage would expand to include my mental health care. And I could keep all my doctors, which I know was the catchphrase. So I moved to DC, and with the savings that I saw, I decided to buy a home. So I'm now a homeowner,
Great.
running my own business, and I actually lead a community of freelancers here in DC. There's over 2,000 of us in the DC metro area. And when I told them that I was coming here to speak with you, some of them actually passed along some statements that I can share as well. And what most people say is, it would not be possible to have a business if not for the ACA. And so you're giving people the opportunity, DC HealthLink, Congress, fingers crossed, are giving people the opportunity to live their dreams. You know, I've had my job longer as a self-employed copywriter than I ever did working for someone else. So this is an opportunity for stability, even in an unstable field. So thank you. And as one of the people who had their premiums lowered when I moved here, thank you for keeping them low for me. And I bet there are a lot of people in Virginia who could benefit from coming across the river.
It leads me to ask, did Virginia expand the Healthcare Act and become part and parcel of the ACA?
They are part of the
Yeah.
ACA, but they work on the national exchange. So it was the compassion that you spoke about, which I've experienced myself, was just not there. They weren't my neighbors answering the phone. You know, they were people who could have been anywhere.
Yeah, I don't understand how that works. It's foreign to me. If you want health insurance, you can't go locally. You've got to go to the national exchange. And how your premiums set? That national,
They're set by the national. Yeah.
Other national.
Yeah.
and that's what makes it high, because all of that is included
Right.
in deciding with none of the measures, for example, like DC HealthLink has taken to make things more affordable because they're dealing with the entire population. And it's very important to know that difference.
So I just want to clarify
Would you?
something. Yeah, so in Virginia or any other state where there's no local state-based marketplace, the big difference is that there's no one advocating for lower rates. The rates themselves are based on that state's population. It's not based on any kind of national, but there's no one advocating for lower rates. That's
And you say
been
based on that state's population.
insured, correct.
And insured in the national, at the national level?
Insured in that state. So, but if no one is advocating, then insurance companies could file double of what they really need. And sometimes you have insurance regulators that just aren't scrutinizing the filings enough, and so they approve very high rates. But there's no one locally advocating for lower rates. That's the big difference.
Thank you, my goodness.
I think our next guest might need to leave at 3:30,
Oh
so
my goodness, please.
can we have her go, because I know she has an
Who is this,
important
please?
perspective.
Margarita DeLone.
Margarita DeLone,
Yes.
who serves in multiple capacities, health insurance broker, who sells DC HealthLink to individuals and the small group clients. Her small business is covered through DC HealthLink. She is the board chair for the Greater Washington Hispanic Chamber of Commerce, which is one of our business partners helping to do outreach and enrollment in the Hispanic community for small businesses and individuals. I'm glad you let us know that she should.
So sorry. So following up, I just want to add, Virginia had not accepted the expansion of Medicaid. I know they're still talking about it now, but they did not. And actually, working with all three markets, I can tell you Virginia has the highest rates. So it really does work to have the local exchange and to be able to have the advocates to keep pricing down. So one of the things that I have the privilege of doing is not only selling insurance through my agency, but through the partnership with DC HealthLink. I've been able to help, for example, at Carlos Rosario, at a couple of the churches that we've worked with, at the library. We've come in and we've helped and advocated and assisted people of all backgrounds in the district. Primarily Hispanic, but not always Hispanic. And we've helped them do applications for DC HealthLink as well as for Medicaid and even for the Alliance program that the district has the privilege of having. And it's been very, very good for us. We've also helped with numerous workshops for small businesses and informing them that they have the opportunity to sign up through the exchange. I had the opportunity, for example, that I had one person with insurance individually in Virginia, but he owned a business in the district. So I came back and offered him, hey, let's put you in the District of Columbia through the shop, and let's offer it through all your employees. And we did. Most of the employees turned it down. I don't know why, but they turned it down. But in his individual case, he saved over $1,000 a month. Mm-hmm. And he went from a $4,500 deductible to a $1,000 deductible. Mm-hmm. And his wife, who had a very serious health condition, was able to get her medicines, etc. And he loves me now. But actually, the love should be through the District of Columbia DC Health. So that's the truth. And, you know, I've been privileged to help many people that have come in. Sometimes I remember one woman who also had a business, but at first she was just so upset because they had found a lump in her breast and she was just going ecstatic. And we put her in. She was scared, and we put her in DC HealthLink. She ended up with Medicaid, and she got the service she needed. So, you know, those kinds of things, when we hear those things, we need to continue this, and every state should expand. Health insurance is a human right. No matter how much people might argue, the prosperity of the country is at stake. As an employer, and I have 8 employees, I pay 100% of my employees' insurance. And one of the reasons I do that is not because I'm in health insurance. I ended up having twins prematurely.
You yourself?
I myself, through different issues. One of them, both of them had different health issues because of the prematurity. One had a grade 2 bleed, the other one had a grade 4. The one who had a grade 4, she had 9 surgeries, brain surgeries, the first year of her life. I dealt with a lot of things. I know what it was like being a single mother struggling with a business. And you know what? We need health insurance more than anything. When someone has that and has that dignity, the fear is gone. You can actually concentrate on making a living and providing for your family. And without that, it jeopardizes our economy, ultimately. It jeopardizes who we are as human beings. So with my daughter, Unfortunately, she did pass at 25, but I know what the struggle's like. So the struggle that you go through as a congresswoman here, thank you. And thank you, Mila, because we need this, and we need to continue to fight to make it better, tweak it, improve it. Social Security didn't start all of a sudden the same way. We worked with it, and throwing it out the door is not the answer. We have to, there are many things that I feel that we need to do. Giving people the opportunity to not be insured is not one of them. Like, that personal responsibility, that needs to be in there, because I've had a lot of young people that will, other than their mother telling them, they decide they don't want it. And they don't understand that anything can happen to them. My son was playing basketball on the weekend, and he had a torn meniscus and torn ACL. That was $42,000, but he had insurance. So you never know. And yes, keeping a cap on, working on the drug issues, yes, that's very important, because it should not be. One of my grandsons now has allergies. First child in our family with allergies. And, the price of that drug, which one is it called? The EpiPen. That when they told my daughter how much that was going to be, luckily my daughter was like, no, I can't afford that. And then the pharmacist was, I have a coupon. But you shouldn't have to be put in that position. That drug was ridiculous. So thank you. Yes, yes. So thank you. And thank you for your time. Sorry, I do have to leave.
But I'm glad you stayed long enough to give that story. Because hearing these stories, and we have one more resident to hear from, is of great importance to us. What we're trying to do in Congress is first to keep the Affordable Health Care Act. You see, we've been able to do that, and by getting the majority, we are clearly in a safe zone now. But you can, as we hear the stories, you can imagine how people outside of the District of Columbia, we just heard about Virginia, why the work in the Congress to make sure we're getting back to at least where we were with people like that, or giving their states some of the insights that you bring so that they can go beyond the national exchange and do something and understand how it saves money and lives to do something in your own district. You are certainly not least. But we wanted to get to our last speaker, who is
Rebecca Barson.
Rebecca Barson. Rebecca Barson is a self-employed resident covered through DC HealthLink's individual marketplace. Ms. Barson is going to speak about pre-existing conditions and prescription cost concerns.
Great. Well, I'm honored to be here. I'm a 14-year DC resident and also a woman with chronic health conditions, most notably, like 28 million other women in this country, chronic migraine. And I'm mentioning that today because June is National Migraine and Headache Awareness Month. I'm also the owner of a small health policy and advocacy consulting firm and a DC HealthLink customer. And as Lisa mentioned, it is not an exaggeration to say that without the ACA and DC HealthLink, I would not be a self-employed small business owner right now, a longtime dream of mine. I actually had the experience of shopping for health insurance while the ACA was being debated in 2010 when I was between jobs and first thought about exploring self-employment. And DC actually did have a guaranteed issue plan at that time, so you could get a plan without medical underwriting, so you could get coverage if you had pre-existing health conditions. But I found that the options and the premiums for that plan were over $1,000 a month before you even paid for any care out of pocket. So, or you could take your chances and get some skimpy health insurance plans that wouldn't necessarily cover all that I needed. So that really took self-employment off the table for me. So I went back to having a full-time job, and when I started to explore self-employment again in 2016, it was a whole different story. I knew that the ACA had really changed the game and that DC HealthLink would be there for me, and I could really start thinking about self-employment again. So, I was amazed at, the comprehensive health insurance that I could get that would let me take care of all my healthcare needs, which includes a fair amount of expensive medications and treatment to help me manage my migraines. I was amazed at all the choices and how easy it was. And quite frankly, I have better health insurance coverage now than a lot of my friends that have employer-provided health care. One of my former employees actually went to a high-deductible, health savings account kind of plan, which really is a real fear for me that I would have to have that kind of coverage. It really wouldn't work for me with my chronic conditions. So I feel incredibly lucky to have care through DC HealthLink. I'm really proud that I've celebrated 3 years in business this winter. I'm thrilled at how DC has really fought to protect the coverage and protections of the Affordable Care Act, our almost universal coverage rate. I do want to say I continue to worry about premiums. When Lisa brought up in the freelance group, lots of people mentioned that they're concerned about premiums. And so I'm really excited to hear that, the Democrats in Congress are trying to, really become that stronger federal partner that we need. I know a lot of what's causing the increased premiums is the increasing price of prescription drugs and in healthcare in general. I went to the doctor yesterday that they offered a new migraine treatment for me. It was $675 out of pocket for a new migraine treatment a month.
A month?
A month.
Wow.
And then the doctor handed me 2 free samples that they just have lying around in their office. And so I'm like, okay, this is crazy. And, there's a lot of new treatments coming out, but they cost a lot of money. I've also seen what happens when expensive treatments go to generic and that the prices come down. So we need to get a handle on this so people can afford their medications and, get the care that they need. And so I'm grateful to everything that DC has done, DC HealthLink and the council and the mayor. And I thank you for fighting for us in Congress. And I'm glad the Democrats are really taking this on. And I hope we can continue the progress. So thanks for having me here today.
So the issues you've opened have only opened more to us. Now, when it comes to the cost of drugs, which is not in the ACA, is there anything the ACA can do about that, or is that really what I have to do in the Congress?
We need you to address that.
Yeah. So the ACA can't say, well, let us get you a cheaper prescription drug. But you see, what I'm hearing today is, with real life experience, is going to be very, very helpful to us in improving the ACA. It's not enough to have saved the ACA. Could you say a word about the Healthcare Alliance? Is that still in existence, and why is it important?
Yes, it's a very important DC locally funded program.
100%.
100% local dollars, no federal dollars. And it's important because it covers people who don't qualify for other coverage.
For example?
For example, undocumented neighbors, our residents. As long as their income levels are below 200% of federal poverty level, they qualify for care through the Alliance. It's a very important way to make sure that no member of our community goes without access to medical care. As all of us know, just because we don't have the insurance card doesn't mean we're healthy all the time.
So what do they have? What does an Alliance person have?
So they have access to...
Do they have a card of some kind?
They do, and they have access to certain medical care that they need.
Now, of course, this is, you would think that that's a decent thing to do. It is. But it's also important for keeping your own insurance rates down. The more people covered, the lower the cost of health care. Now, every jurisdiction in the United States has undocumented people. Well, if they didn't have our version, and you have to ask, why are we willing to pay 100%? Because we have to pay anyway. We haven't sunk so low that if you get sick, and you're undocumented, we say, I'm sorry you're not an American, there's nothing I can do, just go out and die. So a hospital or an emergency room will have to care for you. And that is the penultimate price. That's the highest price. This card is saving everybody money and showing that even decency pays. How about open enrollment? Do we all have to be worried about an open enrollment again?
So because we're a state-based marketplace, we are able to control our own open enrollment, and it's 90 days. DC residents have 3 months every year.
Now, with people already enrolled, is there anything they have to do?
If they like what they have, they don't have to do anything. If they want to shop around, the time to do that is during open enrollment.
Which will be from when to when?
November 1st through January 31st. Now, I'll say the Trump administration unfortunately wants to make it very hard for people who have coverage now to keep their coverage. And one of the proposals that they have is to not allow what we call auto renewal, which means if you have coverage, they want you to
have to go back
and reselect the coverage you already like.
Can they force HealthLink to operate that way?
Well, we strongly weighed in, saying we oppose that effort. So far, they haven't issued any kind of final guidance. But once they do, we'll be looking at that, and we'll be doing the legal analysis whether or not that's legal for them to do.
Well, the next thing to do is to sue. But would you have to follow their regulation?
It depends what they say, but there's a good chance that we would. That we would have to follow their standards, and if we believe that they've exceeded their authority to do something like that, we have been working very closely with our Attorney General Carl Racine, and as you know, his team and he have been filing challenges to Trump administration actions that exceed their administrative authority, and they've been winning.
So you say, if you can't cut them off, can't cut their heads off, try cutting them in other ways. I mean, I think in the history of the world, there's never been a government that has tried to hurt people, to think every year, what can we do to make things worse? This is heartbreaking to hear. Can I ask about younger people? There was some difficulty in getting younger people who believe they will live forever and will never get sick into the ACA in the first place. What about younger people and the ACA? Are they part of the, 97% of the 3%, or have they understood that they better sure be covered too?
We have been very successful through the efforts of our assisters and our navigators and some of the creative marketing that we do. As you may know, especially in the first couple of years, many of our ads were advertised beer, DC Brow, and ice cream and cupcakes, and so that's very appealing to 20-some-year-olds. Also, some of the more creative outreach efforts going to nightclubs and bars, not me, but Katie and her team, Walker, and talking about DC HealthLink, giving out condoms, doing all sorts of creative things to make it cool to enroll in health insurance. And also, we have great mothers, and moms are the ones who are making sure that when their kids get old enough, that they get insured. So we have a very young risk pool, which also helps keep rates lower.
That does. Keep those youngsters keeping our rates down. Well, I have a final question on cost. Whether or not, with all that the ACA has done, do we still have a cost issue for health insurance in the District of Columbia?
Yes.
Has anyone found that, we've heard stories about how your costs have actually gone down when you entered the DC HealthLink, but to what extent is cost still an issue, and why do you think it's still an issue?
It's still an issue for me. Although I'm feeling humbled to hear that you spent $1,400 a month. I'm spending $780, and I thought, I was like, wow, it's like spending an outrageous amount of money. I'm just very, I don't know, suspicious, I guess, about the healthcare industry in general. When you hear about all the CEOs making multi-millions of dollars, I can't help but wonder about the soul or about the compassion that the industry in general has. And I get it's a business. I totally understand it's a business, but ultimately, it's just trickling down to people like me, like all of us here, that are paying for all of those, ridiculous executive salaries and such. And as someone else said here, I think it's important, especially for small businesses, since we are the blood that drives the U.S. economy, so many of us just have stress because of our health and our health insurance or lack of it. So I'd like to think that at some point there might be some way to address the high cost of health insurance, because it's trickling down psychologically and bottom line money for most people.
Well, Democrats control the House, but not the Senate. Still, to the extent that we've already begun to pass legislation for prescription drugs, for example, we believe that it will be impossible for Republicans in the Senate to hold out much longer. The more stories like yours are understood, something we're trying to do this week across the United States, the greater the chances are that we will be able to fix the Affordable Health Care Act the way that D.C. has across the country. And again, the bigger the pool nationally, the better for us all. So I want to just offer my appreciation for what you've done by telling your stories so that residents of the District of Columbia and members of Congress can have this documentary evidence of why healthcare is the #1 issue. It will propel us to keep it that way in the Congress. It will help us as we bring pressure on the Senate, to the extent that people get discouraged when they don't see the Senate moving in the same way. I can only give you the example of D.C. statehood. We're pretty close to having enough co-sponsors for the district to get our statehood bill through the House. So why am I so overjoyed at that? And why do I believe that what we're doing here this afternoon makes a huge difference, even if I can't say to my constituents that the Republican Senate is in our corner? Because that is the way our system works. The reason that every district has a member of Congress is to do what most often has happened in this country, whether you're talking Social Security or the Affordable Health Care Act. It begins in the People's House. One of the reasons that she will also be a hero to me, Speaker Nancy Pelosi, is that she refused to give up when it looked like the Senate, even if in Democratic hands, was about to throw in the towel. And she worked with President Obama to make sure that this kept going, and we did what had not been done in 50 years. It was as important as the 1930s, or maybe 75 years, when we passed Social Security and the rest. It's not going to take that long on health care, because health care, people, the reason we flipped the House, more than any other issue, it was health care. And that really says something, because the majority of Americans have their health care in other ways, don't have their health care the way you do. They still have their health care through the employer, and they still feel the way you indicated. There's still issues to be covered here, even though the employer pays part of their insurance. So what you've done is strengthen my own work in the Congress. You have done several things here this afternoon. You strengthened my own ability as an advocate, as a sponsor, a co-sponsor of several bills here. And you've done something even more important. You've given something well beyond aid and comfort to residents of the District of Columbia to understand that if you fight, you can prevail. As it is now, the fight to retake the House has already made health care, put it on the national map. President Trump's continuing ability to sabotage it is not going to be met with success in the Senate. They are not going to want to take a hand in doing it. To the extent that he can do something administratively, he only helps us to make the case that you have made here this afternoon. So as I close out, I can only say you have given me new, I don't like to use the word ammunition, but that's what it is. I don't shoot real bullets, but I will shoot with what you've given me. Thank you so much for being with us.
Thank you.
Thank you so much.